Hello, I'm Fana Shea and you're watching It's About Youth, the show that talks about issues that matter to youth. Now, World Health Day is celebrated every 7th April, and for this year, the theme is My Health, My Right. Here to talk about this is Dr. Sean Thum from Malaysian Medical Association, as well as Fong, independent health journalist. Thank you so much for joining us.
Thank you.
Let's get into what the theme of World Health Day is all about. So what does the right to health actually means? We start with you, Fong.
Yeah, generally speaking, human beings should have some basic rights, to their existence for them to live a decent and comfortable life. So the right to health would mean that people, should have access to clean air environment and safe drinking water, adequate nutritious food, education, decent working environment, roof over one's head, social support services. All these are needed for a decent living, and it's also for a safe and caring world if we want to have a world like that.
Right, so sort of encompassing sort of every aspect of our lives, the right to health, right?
Yeah.
Would you agree?
Yeah, of course. But to add on to Fong's answer, well, as the Honorary Secretary of the Malaysian Medical Association section concerning health officers, medical officers and specialists, which is the public wing of the Malaysian Medical Association, the right to health is a fundamental principle that actually shapes my perspective and guides my work. So it simply put, right, it actually means that everyone should be able to receive good quality healthcare whenever and wherever they need,
right.
without actually compromising, means suffering from financial hardships. So professionally, this means that I advocate for policies and practices that can actually help achieve that. And personally, it's about equity and justice. It's about making sure that every patient who comes to me would hopefully be able to get good quality healthcare without being affected financially.
Right, so meaning to say that everyone is deserving of healthcare, right?
Yes.
Healthcare treatment.
Exactly.
Right, so how important is actually our right to health, especially with emerging risks when it comes to, we talked about climate change, for example, aging population, NCD, obesity. Is our right to health being threatened with all these emerging new risks? Dr. Sean, you can start first.
Yeah, thank you, Fahana. Well, I wouldn't say that it's actually being threatened, but I would say that the many things that you mentioned just now, climate change, well, I mean, Copernicus Climate Change Service actually just mentioned that February 2024 is actually the hottest month ever recorded.
Right.
And in fact, actually every month since June last year until now is actually the hottest month ever recorded. Based on KKM statistics, even this month itself, there were 28 heat-related illnesses and 1 death. So climate change is a threat, right?
Right.
And also, of course, our Malaysian population is actually aging, which means that we need more healthcare workers, we need more healthcare services available for them. And of course, non-communicable diseases like heart disease, cancer, diabetes are already major causes of death. With increasing numbers, this will actually be threatening to us.
Right.
So ensuring our right to health means that we need to address these emerging risks through policies and actions that can promote health and prevent diseases. And this includes investing in healthcare. We're going to talk a lot more about that.
Yes.
Promoting healthy lifestyles and also addressing social and economic determinants of health.
Right.
What's
Okay. Let's first begin with, you mentioned just now, access to healthcare. Making sure the right to health means that everyone is deserving of healthcare treatment, be it, whether they are rich, they are poor, where they are, and it's quality, right? Quality treatment. So how do we assess the issue of access to healthcare here in Malaysia, and what are the biggest barriers into achieving equitable healthcare for all?
Okay, Malaysians have reasonably good access to healthcare services, whether from public or private healthcare facilities, but the services are still lacking in rural areas and among marginalized populations. So this year will be the 67th year Malaysia achieved an independence from the British, and yet we still have groups of people who, especially in the rural areas, they still do not have access to clean water, and electricity, proper sewage system, roads, and even they don't even have adequate health care, And in other words, this has got to do with other social determinants of health.
Such
Or
as?
they call it the non-medical factors that influence health outcomes. So, for instance, every year, towards the end of the year, during the monsoon season, the NGOs will be bringing in a lot of dry food
Aid and
and
stuff,
stuff for the orang asli, and that's because many of the villages will be like cut off from the rest of the world during because of flood, and it's very difficult to go in, and all this vehicle 4-wheel drive and all that will be damaged as well. So you see, like even things like that, they don't even have tar roads, they don't even have access to all these amenities. So this is has been happening for many years, and it's a great struggle, and so there are still many indigenous people who do not have like clean water supply or even electricity, and they have to travel very far to clinics and hospitals. Yeah, that's one issue.
That's
The other
one
issue,
part of it,
the
yeah.
other issue I want to also bring up is the drug patent. The drug patent issue, which causes high drug costs. So because of that, some patients may not have the means to buy some of these drugs, and some of these drugs can be so expensive that you just die, because you
Yeah.
cannot afford those drugs. And countries tend to, like in Malaysia, one of the issue is we tend to give patents, drug patents too easily, and so there is a need for the government to actually go through and really analyze and see what is really worthy of to be patented for those drugs. It has to be new, and it has to be applicable. It has to be what they call the invention has to be new, and it involve inventive step, and is capable of industrial application when granting drug patents to pharmaceutical companies.
Right.
So if we can get generic drugs, then that will, create
Be a bit more cost-friendly
maybe
as
more
well,
cost-friendly
probably.
and
Right.
affordable.
So I can identify a few there. So cost as a barrier for equitable access, equitable healthcare, and as well as you mentioned just now, for example, infrastructure and transport
Yeah.
becoming probably something that we might not look at properly, like might have missed when it comes to looking at access to healthcare. Dr. Sean, do you have anything to add?
Yes, of course. I think what Fong actually mentioned is actually the hardware of healthcare. The software would include distribution of healthcare providers. This can also be an issue because we know that some places may have got lacking healthcare providers, and this may be a challenge for the populations. But I also, when it comes to talking about right to health, I also want to mention that there are certain vulnerable populations. Fong mentioned one, indigenous people, but there are also some other groups of people like migrant workers, documented, undocumented, stateless persons, and also persons with disabilities who may find challenges actually accessing healthcare. So on a governmental level, I think policies have to be made to ensure that everyone is able to access healthcare when they need it, because it comes back to the point of that's our right to health, and we should be making sure that everyone can get the best healthcare services when they need it.
Right. So talking about the best healthcare services when we need it, access is one aspect to it, getting there, getting, to the hospitals, to getting the medication and all that. What about quality? Quality is another. So is there any barriers in terms of improving the quality of services that we would want to give to the public or all these vulnerable communities, for example? Dr. Sean?
Yeah, Farhana, the answer is going to be one word: investments. Right, investments. In monetary term, budget 2024 is actually quite good for our country, right? Because there was about a 14% increase in terms of the absolute amount, but it remains only about 2 to 3% of our gross domestic product, which is our GDP. Our health white paper,
which is compared to other countries, is very, very different, right?
Very low.
Yeah.
And our health white paper actually envisioned that our country reaches 5% of our GDP. So that we're still quite some time way away. But in human resource terms, right, it also means we have to do better to retain our healthcare workers. Recently, we heard of a lack of healthcare house officers requiring one major hospital, one department in one major hospital to actually consider a zero house officer protocol. And then we also, over the past 3 years, right, over 3,000 medical officers actually quit services. Right. So we need to understand that less health officers mean there's less medical officers, subsequently
Overcrowding and all that.
less specialists. Overcrowding comes in, they get overworked. And when people are overworked, burn out, they are not going to be able to provide quality services. So that's one of our challenges.
I think sometimes you forget that the right to health also extends to medical officers and people, you know, who attend to us, who are deserving to be well as well, to be able to attend to all of us who are sick, right?
Conditions they live in,
Right,
the
right.
working conditions.
Right. Fong, what do you think? Quality services.
Yeah, I definitely agree with Sean regarding the spending by the government. It's only like 2.5% of the GDP. And we need to double that. And we have been saying that for a few years, but it hasn't been very easy, I suppose, for the government. And we haven't seen the figures going up to that, you know, in trying to reach that level.
Right.
But so the government has to be very creative in finding ways to fund this. And specialist treatment, especially in public hospitals, is sorely lacking. So in this aspect, especially the poorer, they don't have that kind of access. And in my experience, sometimes when they don't have a specialist going down the ground, the medical officer or some other specialist will have to communicate with the specialists in other hospitals in order to treat the patients. So you don't have direct contact. So that's kind of not very equitable in that sense. Like
counterproductive as well.
It does help, but it's not like, you know, having specialists directly in front of you, you know, talking to you and treating you, you know. So we get that kind of care here in the cities, but people out there, you know, in the rural areas, they don't get as much.
Right, definitely. I think, and sometimes I feel that we miss that point because we see the situation here in KL, for example, in Klang Valley, everything is going pretty okay, you know, people can still afford the fees for public healthcare system, but it's the situation is quite jarring when you compare it to urban areas, for example.
Rural areas,
Rural areas, right. Right, I think we have established the challenges to access and quality healthcare. Let's look at some of the solutions after this break. Welcome back to It's About Youth. I'm Fana Sheikh, and today we are joined by Dr. Sean from Malaysian Medical Association as well as Fong, independent health journalist, to talk about World Health Day with the team My Health, My Right. Now, we talked about access to healthcare, not just healthcare, but quality healthcare services. Now we want to talk about how to achieve that. We've talked about some of the challenges that we face here in Malaysia, so let's talk about solutions. Let's start with Dr. Sean. How should we prioritize healthcare resources to ensure the right to health can be for all?
Well, Farina, thanks for the question. There are a lot of ways we can do that. I'll highlight 3 here.
Right.
We need to know that health is not just about treatment, and it's about promotion, prevention, treatment, and then rehabilitation. So it's one whole big spectrum. We are all familiar with the adage of, you know, prevention is better than cure, right? So healthcare we must think about preventative healthcare measures. So over here we have got immunization, screenings, and also health education. So immunization would be something like giving people vaccinations, so that you don't contract the illness. So it's actually cheaper to treat over there. Screening means able to let us detect illness before they become more severe. And so education means empowering individuals to make better choices. So this preventative healthcare is one of our focus. Second thing is actually our investment in primary healthcare services. This would be the general practitioners and clinic kesihatan, because these are the first point of contact for our individuals seeking healthcare. If we can actually build up a strong primary healthcare service, we can actually improve overall healthcare outcomes of the nation.
Right.
And of course, we need to focus on the health of vulnerable populations.
Right. Fong, you've been, you know, writing about health healthcare in Malaysia? What do you think?
Yeah, I think Sean has already mentioned most of the things that I would like to mention. So what I like to add is we need to look at other factors as well. The health ministry is not the only ministry that should be taking care of our health. Other ministries should be involved too. Like the ministry that deals with environmental protection, for instance, and the ministry that also work together with the health ministry to provide nutritious food, to ensure that the
agriculture, women, all
yes,
that.
yes, and also the food that is served in the hawker center, or even in the pasar malam or anywhere, that make sure that they are healthy. I can see that we have options, but people tend to gravitate towards the ones that are less healthy.
Yeah, right, definitely.
So I think there should be some incentive, promotion, and active encouragement of healthier food, even among hawkers. Have competitions, have some things where they can get people to be involved as well, to eat healthily, and not just meet the demands of people.
Right. I mean, this comes under the prevention thing that you mentioned just now, right? So making sure
And
that
promotion.
and prevention, making sure that at the get-go we are not contracting diseases because we are healthy from our food choices, for example.
I think I'll just add, if I
Sure,
may,
sure,
I
go
would like
ahead,
to just add
please.
to this, because when we talk about social aspect, right, it's not just one ministry itself that can do that. So education needs to be teaching our children from young. You need to provide people food, at school. All this will add together. So we really need an all-society approach to this.
Right, definitely. I want to touch a little bit about what we said on the first, before we went on a break just now, which is the cost of healthcare. We talked about, those in the rural areas unable to afford healthcare, having problems with access, for example. How do we take on financing healthcare in order for it to be equitable and accessible for all? Foon, let's start with you.
Okay, I'm not a public policy expert,
Right.
but I can speak as a layman what I see happening on the ground, and as a journalist. The bulk of healthcare, I think, should still be taken up by the government, by taxpayers' money through general tax funds. Yeah, because additional income can come from the middle class and upper middle class, and this can be one of the more immediate solutions, where those who can afford can start paying a bit more, while the B40 low-income group can continue with the current low consultation fees, which is RM1 and RM5.
Right.
But don't forget, it's not as cheap as that, because we still have to pay for like diagnostics or the tools, or gadgets and prosthetics.
Yeah.
So it's okay to maintain the price for the B40, but the middle class and upper middle class, we can pay a bit more. And also, I think like university hospitals is a good example. I think if the health ministry want to increase the fees, although I think that it has increased quite a lot for university hospitals, but maybe find a middle ground somewhere,
This will be quite contentious for people who are in the group bracket. What do you think, Dr. Sean?
I mean, we can certainly consider reviewing public healthcare fees to be more commensurate to the different affordability levels. This can be one of the models that we consider. But there are actually other manners that can be useful as well.
Right.
So one of it is actually what we are doing right now with Skin Probatan Madani, where there's a form of public-private partnership. Right. So Protect Health, which is the company, develops evidence-based benefit packages.
Right.
Then that covers a set of items, services and medications at affordable fees. Then the government will finance a certain amount of the expenditure, and then the patient tops up if the amount is exceed lah. So, but one thing that we need to make sure that is that when we do this, it must be a win-win-win scenario. So the people must win, the providers must be able to benefit from it, and so the public sector, which is the government, should be benefit
Right,
from it as well.
three-prong, everyone must win.
Three-prong, yeah. It must be a three-prong win. If one part lose, it's going to be difficult for the whole ecosystem. But another way that we can perhaps explore is actually contributory schemes, like that can reduce our expenditure, which is quite high, whilst providing greater pooling of health and financial risk. So like this, you can consider Taiwan with their nationwide 健保 insurance system, which can be suitable in the long run as well. But Farhana, this list is not exhaustive.
Yeah.
But one thing is certain, our current tax-based government funding system, which depends very significantly on government funding, may not be sustainable for the long run. So we need to consider something else.
Right. There's talks of, WHO has commended us on having universal healthcare. That's been evident. But we don't have national insurance scheme, for example. Is it something, and it is being talked about in healthcare experts and academics to set up this sort of social insurance scheme in order to make healthcare more affordable. Is this something that we should consider in improving access, Sean?
Yeah, the short answer is yes. Short answer is yes. I've always been of the perspective that the society has a need lah. We have a need for the society to take care of its weakest links, and sometimes
Right.
The society must be responsible, and in terms of supporting those who require assistance. So an insurance system can pool risk, it can pool all the financial investment in this, and it can actually be helpful in that. So my answer to you is yes.
Right. Do you think so too, Foon Fong?
There are many unanswered questions, you know. I understand the government is like wanting to look into this and to have social health insurance or national health insurance. That's also useful in getting the private sector to come in as well, to be responsible for the health of the nation to some extent, you know. So the thing is now I would like to highlight some of the questions, but before that we need to see like in the health white paper it says that the government's the MOH roles, the health ministry role as a service provider will be transformed to one as just a regulator and a policy maker. There are strong indications that the government is keen to introduce the national health insurance. Okay, so because and as such, in other words, right, it's likely that the public hospitals will be corporatized, and while private hospitals will be roped in to provide healthcare as at negotiated price. So the people will have to pay premium to an NHI, and for one, okay, the government will pay for the premiums for the B40. It's kind of expected lah. I believe the government would do that, but that's around 10% of the population that are paying tax. Okay, so you have 40% and you have 10%, so 50%. And what about the other 50% of the population? Who will bear the cost? So like things like that, it's we have not got answers from the government, even though some of these issues have been raised, you know, in the media. And who is going to fund those with rare diseases because they're very expensive? And what about during pandemic? How are you going to coordinate with all the different entities all by themselves and all that? Whereas if you have one unified system, you know, during pandemic, you just mobilize the whole, you know, structure, and it moves. And that's how we managed to contain the pandemic, you know, as best as we could. Yeah.
I mean, that's definitely, there are a lot of models that we obviously can look at. You know, Sean mentioned Taiwan just now, and I'm pretty sure there are other models, especially in our neighboring countries, that we can look at when it comes to improving access to healthcare. We're wrapping up, but I just want one last question from the both of you, which is how do we ourselves as a society protect our right to health? In brief, Dr. Sean.
Well, thanks, Farhana. So firstly, maintain a healthy lifestyle. You need to find out you need to also stay informed, so find out what is important for our health and practice those. And also the most important one is actually for us to advocate for health. Right. So we need to support policies, initiatives that promote health and healthcare in general. And like for example, support policies that ban children and adolescents from purchasing smoking or vaping products. Yeah,
that's a big one. Yeah.
We got to lobby the government for better welfare and treatment of healthcare workers. These are important things, but can be done by each and every one of us.
Yeah, definitely. Easy done. Foon Fong, to wrap it up?
Yeah, I think especially the youth, because a lot of things are changing, a lot of things are happening. There's so many things in the world, as like disaster and, you know, conflicts and all that. And the young have to take note of all these changes, and they must also speak up for themselves, because the healthcare that we have now will be for the future, whatever that is planned or reformed. So they should speak up and talk about it, and talk to their MPs about it, and ask more questions, and do their own research as well. I think the young these days, they are quite smart. They know how to find things and read for themselves and decide for themselves. So this reform and whatever that is going on, and whatever healthcare they want to achieve, it's for them lah, basically. So they should be in the forefront instead of us oldies speaking on it.
Yeah, I mean, I definitely agree, and this is part of it, talking about, healthcare reforms, how to improve access and quality services, and this is part of it, and we hope the youth, can take this as research, take this as something that they can bring to their MPs, for example. Right, unfortunately, that's all the time we have. Thank you so much for joining me. World Health Day, April 7th, My Health, My Right. I'm Fanashe. Thank you for watching.